everybody. Welcome to Digital Health Talks. I'm Megan Antonelli, CEO of Health Impact Live, and I am so excited to be here today with a friend who I've met through HIMSS SoCal, Mario Magsaysay, which I love to say. Mario is the Information Systems Application Manager at Pomona Valley Hospital Medical Center. His path to IT leadership started at the Bedside, more than a decade as a registered nurse in med-surg oncology before moving into clinical informatics and building a career at the intersection of care and delivery. He brings a perspective that is frankly rare in health IT leadership, and I cannot wait to hear what he took away from HIMSS and what he's building right now. Mario, welcome to Digital Health Talks.
Thank you, Megan, for having me.
I'm excited to have you here. As I said, we met met through HIMSS SoCal, and we got to spend a day down at AI Med working the booth together, which
that's correct.
And I enjoyed talking to you so much there. I thought, well, we should have you on the show for sure and hear about, your journey and kind of what you have brought to Pomona Valley. But, so tell us a little bit about that.
So, yes, my journey to where I am right now. So basically, as you mentioned, I started as a bedside nurse, many moons ago. And I'm into technology. And so kind of thinking things and building things. And then my boss at that time said, "Hey, Mario, we have a small project to, electronicize our system, upgrading our system. We used to have a legacy, really old legacy system, like a DOS look-like system where it doesn't talk to departments and all that." So she said, why don't you join the project? And so I joined the project, not knowing that joining the project, I was going to be a team lead, leading a project to implement a base EHR application of Meditech at that time. And I started falling in love with project and planning and implementing something that's, making a different organization, improving the care delivery. So I did that. I implemented a bunch of project afterwards and did clinical informatics for a bunch of years. And now I'm here in Pomona as the IS applications manager.
Yeah. So tell us a little bit about Pomona Valley. For those of us, I'm familiar with it being here in Southern California, but around the country, they may not be. Tell us a little bit about that health system and even the community it serves.
Yes. So we're located in Pomona Valley. So we're a trauma level 1 hospital. We're about 400 plus. Don't quote me on this. I always remember 400 plus beds, average census of about 200. We have ER, ICU, surgery. So we're standalone system. We're not a part of like Kaiser or Common Spirit or Prime Healthcare. So we have a bunch of urgent care as well, and so we serve a bunch of I would say medical low income population. But So it's just a standalone community hospital.
Yeah. And that's and I think where Pomona Valley is in terms of the context of Los Angeles, it's just sort of northeast, right?
Yes. And close to San Dimas, West Covina, because I'm from Southern California, so it's
right. You just know where it is. Absolutely. Yeah. No. Well, we all know where San Dimas is because of the Circle K, right? Or at least those of us of that generation. But and of course, we got to go just recently to HIMSS Global in Las Vegas, which we had a lot of our SoCal friends were there, which was nice to see. But tell us a little bit about your experience. I'd love to hear from your perspective as a leader at a regional hospital, what you felt in terms of value was there, and just your perceptions of kind of what's happening and how it's evolving right now.
Yep. Good question. So no, I really love going to HIMSS. I've been going to HIMSS since even pre-pandemic, and I try to attend as much as I can every year. There's a lot of things to learn at HIMSS. So whether you're government policy, whether you're in cybersecurity, whether you're clinical informatics in IT. So there's a lot of things to learn at HIMSS. So and normally when I go to HIMSS, I do like a different team. So like 3 years ago, I was focused more on the clinical informatics side. So I attended a lot of clinical informatics session. Last year I did mostly around AI, and this year I did combination of AI and cybersecurity. So there's a lot, and that's why I love going to HIMSS, because it doesn't matter what's your preference. There's always going to be something to attend and something to learn new at HIMSS.
Yeah.
That's why.
100%. I was actually just writing up my, kind of recap, and it's really focused on the breadth of the topics that are there. And in some ways, it is the strength, right? I mean, that it covers everything. And I felt this year's content really did dig deep and have some really amazing sessions. And then you're there and you just don't, it's so hard to choose which one to go to because it's so
I know.
fun.
Yeah, sometimes I wish I could split myself, because sometimes there's like two session that I want to attend, and you just have to choose which one you want to do at that time. And hopefully they'll have some recordings and slides available for the one that you miss, right? So
yes, 100%. In terms of the ones that you did, were there any standout sessions that you really thought stood out to sort of be sort of progressive and new information?
Oh, I attended. I forgot the name of the first session, but it was more on contracting and third party risk assessment. So there was a panel of a couple of CIOs and one of enterprise legal counsel that was talking about HIPAA, mentioning that when a vendor said something that they're 100% HIPAA compliance, you kind of start to think about that twice, because HIPAA is not like a certification; it's a journey, right? You can never say I'm 100% HIPAA compliant. You have to work towards making sure that you're 100% or complying with HIPAA. So that was an interesting take on that. But then he mentioned something about, if he walk around the showroom, all of the vendor there will say yes, they're 100% HIPAA compliant. So it's like that's a pretty interesting take on that. And then he mentioned about making sure how the contract should be referenced. When you were working with a vendor, like risk management, and making sure you have a really good partnership with those vendors. So that was a really good session, because right now at Pomona, what I do is not only that I manage application, I facilitate the what we call a technology integration and planning committee, where we review requests, whatever request it is, an application integration with another system. So it kind of helped reemphasize what we're doing right at Pomona. So that's why I really enjoyed that session. But there's a lot. I mean,
many. And that's, I think, one of the things that's so important, and a distinction between HIMSS and a little bit NVive, is that it really, that's tactical information, operational stuff that you really, you need to do your day-to-day job. And for them to be able to sort of cover, the big topics from, keynotes with Jeremy Renner talking about, sort of patients and experience and how important that is, to managing contracts with your vendors, which of course is the day-to-day reality of this job, is an impressive thing for them to be able to do, for sure. And of course, a lot of what people are there to hear about in all the new technologies in terms of ambient and clinical documentation, were there any particular areas in, sort of the AI, in the hype cycle versus the reality of what you think the promise is, that you got excited about?
Yeah, I mean the agentic AI, the ambient AI, those are it really shows a lot of values already, like improving the workflow for clinicians, right? From the doctors, I mean, they're excited about it. We're waiting to see it from the nursing side. I know at Pomona, we introduced what we call, we use Oracle, so it's a clinical AI agent for our providers, but we're looking into introducing that to our nurses, not just to physicians. So those are very exciting technology that could definitely help with physician burnout, with clinician burnout, improve the workflow, and hopefully provide more time for the physician to be available at the bedside for the patient, right? So those are some of the exciting technology. There's a couple of technology about I attended one session where they had a study on the AI being used in radiology to help detect mass and tumor and bleed, that kind of supplement the clinician to say, hey, looks like this is the what do you call it, a potential impression, but then please validate and make sure that it's correct. So those are a lot of exciting technology that's coming with AI.
Yeah. And as a nurse, and in your past lives, in terms of what do you bring to that when you're looking at sort of the, as these technology companies, as you said, sometimes they say we're 100% HIPAA compliant. We are using AI to fix the workflows. Is there what do you hear when they really say that, and what questions do you ask to see, is this real?
Yes, and those are good questions. I mean, it's kind of like a double-edged sword, right? There's certain values that it will bring to the organization, but then there's a downstream impact, like any other technology. Any changes, there's always something like, what are we missing, right? So like with agentic AI, I mean, how are we going to handle an AI agent when it accessing our EHR? What's that audit look like, right? When a clinician use the AI and say, I don't know, or Oracle or whatever that is, order me CBC, BMP lab, a chest X-ray. Is that a telephone order? Is that a verbal order? Does that need to be authenticated? What does look like, right? What's the regulatory and rules and regs that we need to update because of that? Is that considered does that need to be authenticated by physician, right? So those are the things that maybe we need to kind of, okay, how do we anticipate those? When we ask an AI agent to say, hey, pull me the chart of, Jeremy, like a BIP patient, how do we audit that? And do we tie that to the clinician who asked the agent, or is that agents from the auditing perspective? So those are the things that kind of like operationally, how do you handle, right? The technology is moving so fast that we need to catch up. Governance, policies, and auditing, and how do we provision this AI agent? I mean, so those are the things that we kind of need to kind of pause a little bit and think about what do we do then?
Yeah, I mean, it's that difference between kind of what's possible, practical, and then, as you said, HIPAA. When did HIPAA come out? Like 1998, right? And so we're still on that journey. Every organization is still on that journey of evolving and kind of interpreting what that means as new technologies are introduced to that. And then with, as you look at AI and that journey of what does it mean to implement, what does it mean to have effective governance, and all that lie. I mean, it does. It gets to be like if you give a mouse a cookie, right? I mean, if you give healthcare a cookie, we're definitely going to overcomplicate it. We're going to want it, but we've got to, and there's going to be another cookie down the way that you think about it, and it just becomes more and more questions of how do you do this and how do you do it well. So there's no shortage of that. In terms of like where you work in sort of cross looking at EHR optimization and integration and analytics within a community hospital, go to a conference like HIMSS or anywhere throughout the course of that, sometimes I sort of think is this relevant to all health systems? Where are the health systems? When you're talking about community health systems versus large academic medical systems, there's a big, there's a gap, there's a difference. When you see that, when you hear some of these, sessions or, people talking, what do you think about in terms of your own organization and the realities there?
Yep. I'm always in awe. I was like, oh my God, if we have all the resources and bandwidth and financial resource available, we can do all of this. So yeah, sometimes I'm kind of jealous and envious, right? I was like, wow, they can do that. And with a community hospital, it's like reality, right? We have to manage our budget wisely, and we got to put it to be able to support the day-to-day operations. So trying to rationalize and invest on a technology that we don't know the value it's going to bring eventually, it's a little bit difficult. So yes, but it helps kind of inspire us to say, they were able to do this because, as a result, it saved them this much money, right? So then it kind of help us like, well, maybe we should look into that, especially if we're having that same issue as well, right? It will be able to save significant amount of money by introducing certain technology. Then by all means, at least they started already. Started the journey. Those large organizations started the journey. Started showing the ROI already.
Yeah,
we don't have to go through that anymore.
Right.
Now the challenge, though, because some large organization they can build the AI, they can build the technology because they have the resource. From a small community hospital, I mean, that's not a reality. We have to find a partner that can help us not only build that model, build that technology, and also partner with us in the long run. So that's the challenging part.
Yeah, but that's also another benefit of having those kinds of communities and conferences is to build those, those partnerships, and certainly there are a lot of interest in, pilots and how technology companies can kind of help community health systems can overcome some of these resource gaps, right? I mean, those resource gaps are, certainly even big academic medical systems feel it in their own way, right? But it is, it's that partnership or that ability to do that, and also just to learn from what they've done. I guess when you look around and you see what people have done, and maybe where some of these implementations aren't getting value, are there any things that jump out to you and say, I don't think I'm going to do that, or we're going to definitely wait to do that because the value is there?
There's a lot of those. But really, before you introduce the technology, you got to understand what problem are you trying to solve. I mean, is it your ED throughput? Is it your surgery turnaround time? I mean, so before you even look at AI to fix a problem, because I mean, if you ask AI a problem, it will fix it, right? But is it really your problem? Is it really affecting the organization? And how high is that priority, right? I mean, I guess like any other hospital organization, the priority is like, how do we keep our operation staying in the black and not being in the red, right? I mean, I think that's the biggest problem. And then there's a lot of companies that, yeah, we can come to your organization and save you millions of dollars. I don't think that's the right approach yet.
Right.
But I think you need to kind of understand from the strategy perspective, what is the problem that we're having that's eating a lot of our revenue, and how do we address it, right? I mean, operation is probably the big one. So that the whole, helping clinicians with their documentation, that will help with your labor, that would help with your overtime, that would help with your resource and turnover with your staff. So that's a true technology that will provide real good value in your organization, right? So I think you start there, and then the rest then you prioritize based on what other problem the organization face, right?
Yeah, no, I think, a lot of watching technology be implemented in healthcare and the cycle of the hype cycles of the innovation comes and sometimes it's, trying to find the problem that the technology can solve, because healthcare's got so many problems. It's not that hard. But
I mean, where do we start?
Right. And so you can do that, but then you wonder, you take a step back and you say, okay, are we solving the right problems at the right time? Are we, and have we prioritized this right? And sometimes, especially with the workflow discussion, it's a question of, are we automating things that we shouldn't even be doing in the first place? And it becomes, again, you get into that journey where once you see what's possible, and then it's like, well, should we even be doing it? And it's a constant innovation cycle, basically, of improvement.
Yeah, and it kind of brings me to, like, my CIO. He always said, automation is not gonna be big bad process, right? So I mean, it's just gonna kind of probably make it bigger or faster, right? So I think you need to fix, people, process, platform, right? So sometimes platform is not going to fix any people issues or process issues, right? So we gotta fix those two. So all three of them have to align.
Yeah, and I heard that a lot last week, which was sort of healthcare doesn't have a technology problem. It has people process people process problems that technology can help with, but we have to make sure we're solving for the right problem.
Because technology is going to make those people and process faster,
right.
Problem faster, right? So.
Right? And you don't necessarily want to amplify the problems, right?
That's right.
I think it's interesting. And I think, we saw a lot around, interoperability and the challenges with interoperability that have happened for years. And then you have kind of in terms of data exchange and what, if you don't have great data, you don't have great data, and it doesn't matter if it's interoperable. Part of that is, it becomes a challenge from your perspective, because I know you work a lot in informatics. Where do you see the, sort of what's the right thing to focus on right now, given, the more you automate of the data that you have, you can get into.
Yeah. Oh my God, with meaningful use, when I implemented meaningful use, there's like, okay, we need to enter operable. We need to send data to the next provider so that the data is available for them. So it becomes like, I think we try to do it too fast, and we try to make it like checkbox. Yep, I'd send it, but whatever that looks like, whether that's meaningful, whether it's interoperable, whether it's structured, that's going to be their problem now, right? Mm-hmm.
Right.
And so now we it's not about, the issue is not really just, we can't interoperable. We can exchange data. Yes, we can exchange data. The problem is the data is not structured and meaningful for the clinician to use. So it's like we're getting this ton of data, whether it's the right time, right patient. I mean, probably getting close to the right patient now, but it's just so much that it's not meaningful. When you get this, like a binder of information about a patient, how do you navigate around that and say, okay, which part of this I'm going to use for my patient to take care of patient properly, right? So now we need to find a way to make it structured, right? Find a way to make it meaningful for the clinician. Find a way so that it makes sense, right? It's not just a checkbox. I send a data, now it's your problem.
And healthcare loves our checkboxes, right? And I think around, right around meaningful use. I mean, that was sort of the checklist manifest, or it was,
yes.
I mean, all the patient safety and quality, and in those contexts, yes, checking the box is the right thing to do, and you want to do that. But around sort of technology implementation and what meaningful use meant versus meaningful outcomes, right? It was like, we just need this here. Are we really thinking about the end game? And I think, as I talk to people around the country, that the lessons learned from EHR implementation are certainly informing this new transformation around AI, right? In that they recognize that they did move a little fast. They didn't involve all the right people. Now I think there's a lot more of making sure nurses are at the table, making sure doctors are at the table to ensure that this technology not only solves the right problem, but is the we're implementing it at the right pace, and as we talked about before, the more questions, the more people you have at the table, more questions you have, and it slows things down. But that's the right thing, when you're talking about something so transformational.
Yeah, and I think yes, we learn from those mistakes, and we're including nurses now and clinicians, and more clinician on the table, not just technologists. We're letting the clinician drive, not the technologists to drive, right? So we let we let the people that's on the bed at the bedside, living the process day to day, decide on what's best for the patient. So that's a good thing.
Yeah. So when you look at, kind of what we talked a little bit about this, but like you were at HIMSS, you saw these technologies, you come back to Pomona Valley, you work on kind of IS applications and driving the clinical and operation. What do you look at that you're going to, this is what we need to focus on? What were your, this is, or was it more affirmation of we're focusing on the right thing? So what's I went to the conference and now I'm going to do this next steps. No pressure.
No, I think yes. Well, as I mentioned, I think we're looking at the clinical AI agent to be implemented to the nurses as well, not just to providers. So that's happening at Pomona. We're updating our identity management system to make it a little bit more streamlined and automated, using a new system that has an AI component and up to date. So, and this is so that we not only secure our environment, making sure that the clinician have access to the system that they need on day one using role-based access management, but also be more efficient, improving that process, right? So not having a lot of manual process done for provisioning. So we're doing that, and then we're also working on our changing our bed management system with a more robust system that has an AI component as well with predictive analytics. So those are the things that we're doing that I know that will bring values to the organization.
Yeah, no, all super important. That identity management piece too. It's that friction point for clinicians to sort of reduce friction so that they can then have that efficiency and improve workflows for sure. And there's just so many steps along the way where there is friction, you want to reduce it as much as possible for sure.
Yeah. I think, with me as an applications manager, what I'm looking for eventually is we do a lot of integration with that one application to another application, but sometimes we miss the deeper integration. When I say about deeper integration, meaning it's almost like seamless, single sign-on, LDAP. Your identity. It's not logging into another application. It's completing that clinical workflow. And so, I think there's definitely some improvement with some of the vendors that we're working on, and some vendors are actually getting better and kind of going to that, saying, okay, yeah, we need to be LDAP sync or SAM authentication somewhere where it's a single sign-on. It uses your AD credential values when you're logging. So I'm hopeful for that. I think it's getting better. When I first joined Pomona, there was a lot of challenge with that, and we kind of fix it along the way.
Yeah. Yeah, well, it happens when there's so many systems involved too, and then you have departments and different tech and all of that. So, but vendors getting better is a good thing. We we have a segment called 5 Good Things that we talk about. There's sort of 5 good things that happened in the last month or so. So we always like to end our digital health talks interview on, kind of what you're most excited about in the next few years, in the next, few months, in terms of just sort of what's good and what's coming for healthcare. Sometimes we get bogged down in the negative, so we like to end up on the positive.
No, I think AI. We talk about the benefits of AI, right? I think those are 5 good. The value that it can bring to organizations. Those are like the agentic AI, the ambient AI. Those are good things coming as long as we know how to manage it accordingly and understand the risks and all that. I think interoperability works to do, but I think it's there. We got the data. Now we need to figure out how we're going to make it structured, right? I think interoperability, integration, we just need to find vendors are getting better, deeper integration. So we just need to work towards it. We just need, I think vendors are getting better. Hopefully, knock on wood. Or if they're not getting better, don't partner with them. Just kidding.
Right.
And so, I don't. What else? And technologies. I mean, I think overall, I think we're from the IT perspective. I think we're getting better. We're slow in health IT compared to other industry, but some of the IT leaders that I met are very knowledgeable with the clinical side and healthcare side. So I'm very impressed with that.
Yeah.
So
yeah, no, I think that slow and smarter, right? Slow is always going to be the case because you just can't rush things like this. And so slow is okay as long as we're smarter. And I agree. I think they're getting smarter. The technology vendors are getting more knowledgeable about the complexities of healthcare. And as it couldn't be at a more important time because the technology is moving so fast. So, well, thank you so much. It's always a pleasure chatting with you and hearing about your work and kind of, the unique perspective you bring to it. So thanks for joining us.
Thanks, Megan.
All right. Well, thanks so much. This is exactly the conversation our listeners need more of. The view from a community hospital, from someone who has delivered care and now builds the systems that support it. That perspective is invaluable and too often missing from the bigger stage. For listeners who want to connect with Mario, you can find him on LinkedIn or at a regional SoCal HIMSS event for sure. And then for Health Impact, where to find us at Health Impact Live. And if you enjoyed today's chat, please subscribe to Digital Health Talks wherever you get your podcasts. And follow the Health Impact Live YouTube channel for more conversations with leaders shaping the future of healthcare technology. We'll see you next week.